Every day, millions sit for hours without realizing a hidden muscle group is quietly changing how their body moves and how it manages sugar. These are your hip flexors, the muscles behind every step you take, and possibly connected to how your body controls blood sugar. By the end of this video, you'll understand exactly how these muscles work, why they tighten, and how that connects to diabetes.
The hip flexor group includes the psoas major, iliacus, rectus femoris, and sartorius, muscles connecting your spine to your thigh bone.
The psoas major originates along the transverse processes and bodies of the lower thoracic and lumbar vertebrae, descends across the pelvic brim, passes in front of the hip joint, and curves inward to insert on the lesser trochanter, making it the body's deepest and most powerful hip flexor. Seen from the side, the psoas major's path becomes clear, originating along the lower spine, sweeping forward across the pelvis, passing in front of the hip joint, then curving back to anchor deep at the lesser trochanter. Together, these muscles lift the knee toward the chest and let you walk, run, climb stairs, and simply stand upright. With every stride, the hip flexors contract to swing your leg forward, a motion repeated thousands of times throughout the day. This tilt increases the curve in your lower spine, adding mechanical stress to the vertebrae and surrounding tissue over time.
Tight hip flexors also weaken the glutes through a process called reciprocal inhibition, disrupting how the body generates movement.
Over time, this imbalance changes your walking pattern, forcing other muscles to compensate and work harder than they should. Reduced hip extension limits your range of motion, making everyday movements like standing tall or walking briskly noticeably harder. When you sit, your hips stay flexed near 90 degrees, keeping hip flexor muscles in a shortened position for hours at a time. Research shows prolonged sitting leads to adaptive muscle shortening, increasing passive stiffness in the hip flexors over time.
A cross-sectional study found people with more sedentary time had significantly limited hip extension compared to active individuals.
This tightness is strongly linked to lower back pain, one of the most common complaints among people with sedentary jobs. Over months and years, this postural shift can affect balance, core stability, and even breathing mechanics during daily activity. Tight, weakened hip flexors reduce mobility and exercise capacity, making physical activity feel harder and less appealing to maintain. Muscle contraction activates glucose transporters called GLUT4, pulling sugar out of the bloodstream and into working muscle cells. Here's the critical link. Skeletal muscles are among the body's largest consumers of blood glucose, especially during movement. Studies published in exercise physiology journals show reduced sitting time significantly improves insulin sensitivity in the thigh muscles. Studies show frequent short walking breaks during prolonged sitting reduce blood sugar spikes more effectively than one long workout. Since hip flexors initiate walking, tight or weak hip flexors can indirectly reduce daily movement, lowering muscle glucose uptake overall. Large studies confirm prolonged sitting independently increases diabetes risk, regardless of how much structured exercise a person gets weekly. The good news: hip flexor tightness and its downstream effects are highly reversible with consistent, targeted movement. A simple kneeling hip flexor stretch held for 30 seconds daily can gradually restore length and reduce pelvic tilt. Strengthening the glutes with bridges helps restore muscular balance, counteracting the tightness caused by hours of sitting. Standing and walking for just 2 minutes every 30 minutes has been shown to meaningfully improve blood sugar regulation. Combining hip mobility work, regular movement breaks, and strength training creates a powerful, evidence-based approach to metabolic health. These small, consistent changes can meaningfully support insulin sensitivity, joint health, and long-term diabetes management over time. Dr. James Levine, a Mayo Clinic researcher, was among the first to show how sedentary behavior quietly damages long-term metabolic health. Dr. David Dunstan's research demonstrated that breaking up prolonged sitting with short activity bursts significantly improves blood sugar control. Their combined research confirms what this video has shown. Movement, muscle health, and metabolic health are deeply interconnected.
Today you learned how hip flexors work, why sitting tightens them, and how that quietly affects your blood sugar control.
If this helped you understand your body better, subscribe to Diabetes 2 Reversals for more science-based health content every week.